Okay. Hello, my name is Bob Emery. I serve as the Vice President for Safety, Health, Environment, and Risk Management for UT Health, and I'm also a professor of occupational health at the UT School of Public Health. And I also function in reserve capacity for the United States Public Health Service Commission Corps. I'm delighted to recognize one of our MD and PhD students, Emery, who receives this national award for his contributions for the field of public health. I wish I could make this presentation live and in person, but ironically I've been asked to provide a training class at the United States Naval Postgraduate School in Monterey, California at the same time that this event is occurring, hence why this is being pre-recorded. Emery completed his Bachelor of Science and Arts in Biochemistry at the University of Texas at Austin. Not only did he receive college honors while there, he also began his research on nutrition and food choices and was the first author on a paper published in Public Health and Nutrition. He continued his commitment to promoting public health practices during his graduate work at the McGovern Medical School and the University of Texas School of Public Health as well. He is currently a student in our MD MPH program and is the founder and president of the Association for Nutrition in Public Health Professions. His organization currently has over 100 student members from medical, dental, and nursing schools, as well as the School of Public Health. The objectives of this group are to train students to discuss with patients how lifestyle habits and nutrition impacts their lives, and to implement nutrition education curricula into the community. Along these lines, in the spring of 2019, Emery started a nutrition education program at Cullen Middle School, and then subsequently partnered with the Landing and Refugee Services of Texas, a nonprofit organization that runs a drop-in center for human trafficking victims. As part of this partnership, his organization developed a nutrition and exercise class covering topics such as how to read a nutrition label, creating a healthy meal, and healthy eating on a budget. Through his roles with the American and Texas Medical Associations, he also advocates for health equity, eliminating health disparities, and improving health of marginalized individuals. He is the current president of the American Medical Association student chapter at McGovern, as well as the AMA delegate to the Texas Medical Association, representing the Medical Student Association. In this role, he has helped write 5 resolutions that have been passed by the AMA Medical Student Section, that include expanding Medicaid transportation to include healthy grocery destinations, expansion on comprehensive sexual health education, opposing tax subsidies for advertisements promoting food and drink of poor nutritional quality amongst children, and racism as a public health threat. During the COVID-19 pandemic, he started working with a nonprofit, Brighter Bites, which many of you may be aware of, to conduct research and to help make resources available to improve health literacy and address social needs among low-income families. The resources that he helped develop covered a variety of topics and were distributed to over 24,000 Brighter Bites families in Houston, Austin, Dallas, New York, Washington, D.C., that's my hometown, by the way, and Southwest Florida. Lastly, if that weren't enough, he also conducted extensive research that includes examining the use of nutrition labels to improve nutrition knowledge and dietary behaviors in adolescents, understanding the relationship between parental and peer social support and adolescent dietary and physical activity behaviors, and looking at the associations between sleep, weight, status, and obesity-related behaviors in children. Since his undergraduate school, this work has led to 7 publications, 6 of them of which he has been a first author. Amir has clearly demonstrated that not only his commitment to improving the lives of others, but has also shown a strong desire to promote advocacy, affect policy, and enrich the learning environment of his academic institutions. Now, I'd like to pause here and to say a word about the Public Health Service. The United States Public Health Service was founded in 1798 to provide medical care to sailors and merchant seamen with yellow fever and malaria. Now, over the subsequent 223 years, our mission has broadened to deliver health promotion and disease prevention to all Americans. Today, the Commission Corps of the United States Public Health Service is dedicated to serving on the front lines of the nation's fight against disease and poor health conditions. So on behalf of the Chief Medical Officer of the United States Public Health Service, I'd like to recognize Amir Haider with the 2021 Excellence in Public Health Service Award. Thank you for your hard work and dedication to public health, and we hope that you possibly consider a career in the U.S. Public Health Service at some time in the future, as the talent and skills that you have demonstrated are crucial to the preservation and protection of our nation's public health.